Hey everyone, Justin Holland here with the Mad Insurance Show. Thank you for joining us on another great show. We're going to kick things off here in just a moment with another special guest I've got. Real excited about this guest. Known him for a few years now. And basically, I guess you could consider it as a sideline in the business. And we visit and stay in touch. And man, I called this gentleman last week. I was like, hey, just checking in on you. We had a great visit. And I was like, man, I got to have you on the show. Let's sit here and vent about our industry and get some awareness out there for all the listeners out there. Now, you might be listening to us here on KTSA 550 or 107.1. Welcome to listening. We're going to talk everything insurance. The Mad Insurance Show, making a difference in insurance. Basically, it's no holds bar on insurance. I talk about individual, ACA, health coverage, Medicare as it relates to seniors, employee benefits. We also talk about life insurance, long-term care planning and long-term care coverage, Social Security as it relates to your retirement, as well as auto, home, and commercial lines of business. This show today, though, we're probably going to focus on individual health insurance. There's a lot to talk about on that, and we've got some great topics to discuss. As always, I want to remind you, Texas State Insurance Services. That's where we got you covered on individual health, Medicare, employee benefits. You can visit us online at txstateinsurance.com, or the phone number is 210-880-5316. Palmetto Life Group is going to be our agency we created for life insurance, long-term care, auto, home, commercial lines, as well as the Social Security workshops. Remember, we're registered Social Security analysts, so we can help you prepare for that. PalmettoLifeGroup.com or 877-357-5316. So I got the housekeeping out of the way for the show. Now I want to dive into our guest. And I'm excited, Luis. We've got Luis Moreno from Insurance Agent Training. He also has other local agencies as well. I met Luis, man, really when the ACA was starting.
We're going on more than 10 years. You said a couple years. Yeah. It's more than 10 years.
You're absolutely right. We've got some history there. We got some great war stories. And hopefully, I say hopefully, I think we're going to provide some good insight for the consumers online. But I got a hit list of questions that I want to review with you. And then we're going to dive into the topics out there.
Beautiful. Let's do it.
First off, Luis, tell us about you. Industry background. I know you've got a military background as well. Can we dive into the history of Luis? Where you started, how you ended up in the insurance business, and where you're at today.
Beautiful. Yes, I would love to. So I have been an agent since 1999. I'm going on 25 years now.
How cool is that?
Okay. So I was a teacher. I after I played some college tennis, I became a teacher.
Okay.
So teachers, firefighters, these other businesses, we're always trying, or these other careers, you got to make a little extra money.
Yeah.
There's not enough money teaching. And then so I was coaching too. So what I started doing when I was teaching is I started selling insurance on the side.
Okay.
Summertime.
Like many people.
Oh, yeah. Yeah. You got to make a little extra money.
Yeah.
There's just not enough in education. So I sold at night and I sold on the weekends. Well, after a couple of years of doing that, I decided one summer just to go at it full time. And I was like, there's money to be made here. So I let my teaching go and dived full time into insurance. And if I wasn't busy enough doing that, I decided to join the National Guard on top of that.
Really?
So I jumped into the Guard at the same time. So I started my individual agency in 99.
Okay.
And then in 2001, I joined the Guard, the Army National Guard here in Texas. So that's how I got into the business. Now, I started an agency with Farmers Insurance in 2001.
Okay.
That is the P&C agency.
Yeah.
I built my team up. In 2008, I don't know if you remember this. You probably
I remember
don't.
08.
2008, what happened in 2008?
We had the financial collapse.
And the mortgage crisis.
Oh, yeah.
Okay, all led by the mortgage crisis.
We bought our first mortgage that year, my wife and I, after being newly married. So I remember that time very well.
Okay. Not only were we dealing with that, but I got sent off a 9-month deployment on top of that during that time. And here's what I learned. And after I got back, I was stressed. Agency had gone down by 40% because we were heavy home. What happened was I had a mentor come up to me and ask me, Luis, what happened? Why are you in the dumps? I'm like, well, I was gone for 9 months. We're like, well, you're an idiot. That's what he told me. And I'm like, what are you talking about? Luis, why are you still selling? You should be running the business. You shouldn't be in the business.
Yeah.
Prior to 2008, I was in the business. I was the guy selling. I changed my entire philosophy. I'm like, if I get deployed again, I am not going to lose my business. So I decided to build the team, a wonderful team. So I've got a team of 14 people in my P&C agency, and that is a very well-oiled machine. It works by itself.
Looks like it.
All that I do is I just got to make the phones ring. They take care of everything. So we'll fast forward to 2020.
Yeah.
In 2020, now during that time, I was also doing health insurance. We started doing ACA in 2014.
Yeah.
I was already doing Medicare. So we were in that health insurance business. But in 2020, I got the opportunity to jump into what I call the evolution of the business, where I felt I had already hit my numbers. I had already done everything I've been doing. I got bored selling. Now I wanted to jump into the realm of training agents.
Got it.
I got an opportunity to train insurance agents to sell ACA, which is the health insurance for people under 65,
Yeah.
and Medicare, people over 65. I got that opportunity and loved it. That's where I created my new endeavor, which is insurance agent training, where we are helping insurance agents do the right thing, help people with ACA and Medicare.
That segues into my next question, because basically we were seeing, all the fraud going out there, major stories on rogue brokers and properly enrolling. You and I both faced, losing clients or them getting disrupted on their coverage and care. Let's talk about that, because the fact that you've got the training situation or standpoint with what you're doing now, I think that's something that the consumer out there needs to consider, that they're dealing with somebody that knows what they're doing in the business and industry.
It was bad. And in fact, it caused a lot of people to get out of the industry. And what's also happening is with our new current administration, there are some new rules put into place that is going to hurt consumers.
Oh, yeah.
If stuff is not done right. So yes, let's reverse a couple of years back. Let's reverse an administration back. The rules, or since Obamacare started, since ACA started, it was the Wild West.
It was a Wild West.
Okay. There were no rules. There was no compliance. Okay. So what happened was, just like every industry, you're going to have the majority of the good ethical agents out there, but you're going to have a small segment of what I called, you said rogue agents, I call them the rat agents.
The rat agents.
Okay. They're out there. And you know what? It is just not in our industry, Justin. It's in any industry. You're going to have the bad ones. You're going to have the ones that will exploit the system.
Oh, yeah.
They'll bend the rules. Okay. They will lie, cheat, steal, anything they can to get ahead. So no matter what industry, you have those guys. Now, we dealt with, just like you said, you lost business. I lost business. Every 10 people that I was helping with insurance, I probably lost 3 of them to agents like that.
I would say a third, yeah.
Yeah, stealing my book. Okay. Now, these rogue agents, once they learn how to do this, they also learned, well, it's so easy. We're going to create some fraudulent enrollments. You'd be amazed. I was looking at policies where it was maybe a mom and dad with 1 or 2 kids.
Mm-hmm.
Magically, they now had 10 kids.
Oh, my goodness.
So that they could earn a commission on those other 8 kids. Okay. I've seen fake enrollments. I've seen one policy on one policy set up for a client, a good one, but I've seen 4 or 5 other different ones. All they did was they changed the date of birth.
What's real frustrating is when we're looking at these applications, somebody reaches out to us for help and we say, okay, well, your income is showing here at $22,000. Well, no, it's not. I make $80,000 a year. And I'm like, well, whoever helped you with this application maximized your tax credit probably to the full extent as what they could do based on your family size. You're going to owe some money back, and they are absolutely shocked. I mean, that's a big one that we've had over the years as well. I'm sure you've seen that all the time.
Well, and here, the shock wasn't that bad. If they were shocked last year, get ready for a real shock this year.
Correct.
So when the income or when any of the data is inaccurate in an application, and it causes you to get a higher subsidy, which a subsidy is the help that you get to help pay your premium.
Every month.
Every single month, you get a little help with your premium to lower that. What will happen is if your data is inaccurate, there's going to be a reconciliation of that data when you file your taxes. Now, if you got too much help, too much subsidy, in the past, you only had to pay a portion back. There was a cap. New administration removed that cap. You will have to pay
all of
every single penny that you got that you should have not got. So get ready for a shock.
And if that's $1,000 a month credit, that's $12,000.
Oh yeah,
I mean that's real money, and the IRS will get their money. That's the enforcement arm of that.
Oh, you can't run from those guys. You cannot run from those guys. So 100% they will get their money back. So, I'm going to finish with one thing. I'm going to just tell you, for you guys that are listening, you want to make sure that your data is accurate. That's where you want to connect with a good, ethical agent. Check the data. Make sure that your income is right. Make sure that your household is right. Make sure that it's right so that you don't get that shock when you file your taxes the following year.
And a lot of times, us as agents too, we do our best. We try to reach out to them by phone. There's mailers that go out and say, hey, keep an eye on this. What's the data on that? If we don't get that back, or you don't submit that on your own, you could have a problem. We're seeing individuals that just did not want to update their income or income verification, and they went from a $200 premium to now to $1,800, on their application. And we're like, hey, guys, you've got to, we're sending you these updates for a reason, okay, to be up on it. And we're seeing more of that as well. CMS is tightening that ACA eligibility. There's going to be Medicaid work requirements. That's one of our topics we're going to bring up. The GLP-1 drug showing up. This is a moving fast industry, okay? It's like going into hyperdrive with everything that we're seeing. As someone who trains agents, what's the biggest shift that you're seeing right now?
Here's what I'm seeing with agents and in the industry. There are so many organizations out there that that have a big budget, they got deep pockets, and they do a great job of recruiting agents and getting them set up with insurance carriers so that they can sell the products. That out there, it's out there. It's everywhere. Now, the key difference and the shift that I'm seeing is a big portion of them do not train, and a even larger portion do not support. This is where connecting with an organization that does that. The problem that I see is that the information that CMS puts out there, these rules, these guidelines, these protections for our consumers, they're not easily sent to the agent. The agent has to go out and hunt for them. When you pair up with somebody who is in the know, somebody who wants to train agents the right way so that they can build a long-term business, we as trainers have to share that information with insurance agents. It's not hard doing things the right way.
Correct.
It's not hard. It's a little more work, but it's not hard.
But you've put in the hard work to have that training and that development in, because you and I both know, we're not trained. We had to kind of just figure things out. And it was a lot. I mean, trial and error off of that. So you bring in that value to that agent community is huge.
Yeah,
off of that.
And I will tell you, it's not a lot. Doing things right in this business, Justin, is easy. If we just know what to do it every single time without fail, you can build a long-term business, and you can really help people out there. It's when you cut corners, you don't follow the rules, you take the easy route, that problems start.
And they will show up. Those problems will come up. And it's a challenging industry in itself. Future of ACA. Another question here. With 6 million potentially fraudulent enrollments, enhanced subsidies expiring, the political pressure from left and right side of the aisle, where do you think the ACA marketplace goes from here? What should agents, and not just the agents, the actual consumer, the client, be prepared for?
Okay. Well, we're going to go down a political road here.
Let's do it.
And I'm going to stay as neutral as I can.
I'm hoping I can get some of these congressional candidates on the show. So maybe we'll tag them on the stuff that we put on here.
Yes. Okay. So ACA, Obamacare, which is the nickname for the Affordable Care Act, which is ACA. It is a Democratic product.
Yeah.
With that being said, whenever we have a Democratic administration, they want to grow that product. When we have a Republican administration, they want to try to destroy it. There's my political talk on that. Now, the future of ACA. We had Trump 1.0 come into administration.
Yeah.
Part of his platform was he wanted to destroy ACA. He wanted to do away with it. Now, The end result was he did not destroy it.
No.
He dismantled it a little bit, but he did not destroy it.
Even during that administration, he was saying, "Hey, we're going to try to make it better."
Yes.
Do you remember that comment?
Yes, I do.
That came up as well.
Because they didn't have an alternative to it. Okay. Now, here we go with the administration, the Democratic administration after Trump. And all of a sudden now the rules are lax. We can enroll people by bending the rules a little bit. I mean, it got really bad. This is where we had the rogue agents come in and start stealing business. So ACA grew. Now we have Trump 2.0. And in my vision with Trump 2.0 and the vision that I'm seeing is there is no replacement for ACA. ACA is going to become the new Medicare. Okay. And any alternative is really not a good alternative. Trump 2.0 put out, we're going to take the assistance that we send to these big bad insurance companies and we're going to give it to the people. Political talk. They loved it.
Yeah.
We're going to create health savings accounts.
That came out a few months ago.
It did. We're going to open up health savings accounts and we're going to dump $1,000, $2,000 into your account. The problem is with that strategy is a health savings account is not insurance.
Correct.
Okay, I'm going to share 3 scenarios with you. My brother-in-law, ER visit, diverticulitis, $44,000 bill. My daughter took her to the ER. Half an hour, $4,000 bill for a UTI. My son just broke his arm. Okay, spent one night in a hospital, came out, $27,000 bill. How far is your little measly $2,000 in that health savings account going to take you?
Correct.
The solution, it's not really a solution.
It's not.
It's not going to happen. So the point to your question here is ACA is not going anywhere, in my opinion. It's here to stay. Insurance agents. You've heard some of the craziness in the industry with the stealing of your accounts, and all that is coming to an end. There's been a lot of guidelines.
They've been doing a good job of cleaning that up.
They're cleaning it up, and it's getting better. And so I think for those agents that are out there not doing it because of the horror stories that they've seen, guys, they're horror stories, and they are true,
Yeah.
but they're not going to happen in the future. This is a really good time to be into business and here's the reason why. ACA, health insurance, it's not an easy product to understand. Okay, I tell agents there's 4 key things to every policy: the deductible, the co-insurance, the co-pays, and the maximum out of pocket, which is an insured's worst case scenario in the year.
Overall exposure.
Okay, so it's hard for agents to understand that. Much harder for an insured to understand that. Now, you would think, well, that's all they need to know. Oh, not even close. Every plan has a specific network.
Mm-hmm.
Every plan has a specific formulary, which is the list of drugs. Do you think insureds know that they need to go check that? They don't. The point there is they need us.
They do need us. And to piggyback off of that, you talk about the medication network, the RX formulary. Doctors get out of those networks all the time. They will show, hey, they're in one plan network, and they totally, come out of it as well. So you have to have somebody that's helping you be proactive on that option as well.
100%. And here's the beauty of this help. It's at no cost to the insured. Okay, so an insured is not going to pay more to utilize us. We get compensated by the insurance companies.
Correct.
The premium that the insureds pay is the same whether they use an agent or not. So it's really to the insured's advantage to use an agent, a good ethical agent like us, because we can make sure that we put them into the right plans. Now, Justin, it's just not a matter of the parts of a health plan, the network, the formulary, but there's also different levels. We have bronze, we have expanded bronze, we have silver, we have gold. It's hard for an agent to understand that. How is an insured going to know that? Point being is that we are truly needed in this industry.
Something just popped in my head on this as well, and I know you see it. We have so many people that call into our agency, and they're like, hey, I'm on this plan, and it's horrible, and it sucks. And a lot of times, it's health coverage. It's an insurance, or not even an insurance. It's a health coverage piggybacking off of a network that's underwritten through a life insurance product or company. So we see that a lot as well. People don't realize there is a difference between health insurance and health coverage.
Yes.
Okay. One, pre-existing conditions apply. The other, hey, you know what? We're going to underwrite you no matter what. So that's just one other value add that we help our clients take a look at that you just don't know. I wouldn't know if I was in the industry and business.
Well, here's the deal, and this is where you have some of these rogue agents. They sell these coverages with the term it's attached to a PPO network.
Oh yeah.
And all of a sudden, oh, it's a PPO network. That's what I've been wanting. It's great. Well, really, and those products are not bad, Justin. They're great products,
Yeah.
but they're supposed to sit on top of an insurance plan.
Correct.
They're supposed to help and supplement a true plan. They're not supposed to be the true plan. And I guess it's better than nothing,
Yeah.
but it is in no way should it be understood that it is truly health insurance, because it's not. It's coverage, just like you
Or
said.
we've got the opportunity and option with Presidio. Granted, the employee needs to, or the client needs to be healthy. Had a great visit. I know you talked to Sergio last week
Yes.
as well. I'm excited. We've got another arrow in our quiver to so to speak, to be able to help our clients have an option. Again, not for everybody, but that's a breath of fresh air on maybe what we'll see more of as we have options. Because the week before that, I had Physicians Mutual on, and Robert Davis said something that's really stuck with me since then, because we were talking about ACA, and I was saying, God, they should have done a temporary reprieve and allowed those expanded subsidies to go. And Robert was like, man, we can't expect the government or wait for the government to help us on this. We got to look at solutions. Now, hopefully, the private market will come in with something. And that resonated with me, because I was upset that I had clients that were going, just they had to close their coverage. They had to term it out because they just can't afford it. I still have them every week. Justin, I know I told you I wanted to keep this as long as I could. They can't afford it, and that's heartbreaking for us as agents, because some of these individuals are ill. They got some serious medical stuff, and they're having to choose, either my medical premium or, gas or food and
Or
stuff like that,
mortgage.
or mortgage payment on the house. And man, I'm an optimist. I think our best days are ahead of us, but it's very important to be with an agent that is going to help you navigate that for the long haul as
And
well.
again, another reason why we're needed. ACA is not the answer for everybody. There are other products out there, and I love Presidio. They came in with a very unique product,
The right time.
and also at the right time, because we didn't lose subsidies. So you mentioned something here about subsidies. Guys, the new administration did not get rid of these subsidies.
Correct. Those still exist.
Yes. We just don't have the expanded subsidies that we had during the previous administration.
Let's just call it middle class America. You know what I
Yes.
mean? And for the listeners out there, basically we're talking families of joint incomes, let's say 80 plus to 120. We had clients well over into, a couple $100,000 a year are still qualifying for credits,
Yes.
and those went away. So you had a middle class America that got a taste of I guess what we would deem affordable coverage, and then that got stripped away after having it for 24 months. That was the big shock, and I think we've got some solutions for many people, maybe not all of them, but Presidio has been dynamite.
Presidio's one. And then here's the deal. When you talk to an agent that's in the know, an agent who has tools, there's ways that we can supplement with some of these extra coverages to help move you into a plan with a lower premium, but supplement them with another plan that will help you with your out-of-pockets.
Correct.
And that's where you get it. Yeah, that's where going at this from an insured point of view is very, very hard. There's no way for somebody who's not in this business to know this. So from an insured point of view, you want to talk to a good agent, because you give them your scenario, you give them your meds, you give them your doctors, you paint the picture. They can take that picture and come up with solutions to your problems.
And having a veteran agent helps too, because we'll see scenarios out there that even that we'll second guess. It's like, hey, let me double check this, and we'll be that much more prepared for the next client that
Correct.
comes in. Because one minute I think I've seen every scenario, Luis, and then I get somebody that calls in and is like, okay, we have not dealt with that. Let's take a look at that. And we got some great people, great carrier partners that help us answer some of those questions. Let's dive into some articles here in a minute, but I want to remind the audience of who they're listening to. This is Justin Holland with the Mad Insurance Show, Making a Difference in Insurance. I'm with guest host Luis Moreno from Agent Insurance Training, and we're real excited about this because we're talking about some topics here in a minute that I think a lot of people miss and need to be educated on as well. Now, remember, if you got questions regarding your health insurance, Medicare employee benefits, reach out to us at Texas State Insurance Services or visit us online. The online address is txstateinsurance.com or our phone number 210-880-5316. Palmetto Life Group's going to help you out with the life, long-term care planning, Social Security analysis, auto, home, and commercial. That number's 877-357-5316 or palmettolifegroup.com. We've got 4 locations in San Antonio, 1 serving McAllen in the Rio Grande Valley. And then one more shameless plug I got to get out to everybody on our YouTube channel, youtube.com/@Mad Insurance Show. If you go to that show, we're going to have the video of this podcast or episode, so to speak, with Luis and I, and we'll have his information on there linked as well if you want to reach out to Luis with any questions that you've got. So let's start talking articles.
Let's go.
The meat and potatoes. And Luis, I don't know if you noticed in the agenda, I basically put ugly, the good, the bad, and the ugly.
I saw that.
And I sorted that out. We've got it itemized in color, thanks to AI and Claude to help me out with that. But the number one thing is, the ugly. Article number 1 that I wanted to bring up was a Washington Post article on June 2nd of 2026, so just a few days ago. Conservative group alleges 6 million were fraudulently enrolled in ACA. Could possibly be more than that. But the Paragon Health Institute claims that 6.2 million ACA enrollees, roughly 1 in 4, were improperly enrolled. Okay? I'm going to dive into this a little bit more, and then we're going to discuss this with Luis. CMS itself estimated up to 4.4 million potentially improper enrollments alone in 2024. So 2 years ago. Okay? GAO confirmed the able to enroll fake people and get subsidized coverage. So you had agents and agencies and call centers basically bringing up make-believe people, with these enrollments. Rogue brokers enrolled and switched hundreds of thousands. You and I just complained about that a minute ago. We both encountered clients calling in, say, "Hey, Justin, I switched the plan. Luis, I switched the plan. What happened?" Is like, "Did you take a phone call from somebody?" "Well, yeah, but I thought it was you." That whole deal. CMS Administrator Oz called for the major changes. White House Fraud Task Force now targeting ACA. I have a feeling we're going to see some more news on that. But, what does this mean for agents? What does this mean for the consumer? What's your reaction to 6+ million people of fraudulent enrollments?
It's a money grab for not only these rat agents, it's also a money grab for the insurance carriers because a fake person doesn't file claims.
You're absolutely right.
A fake person is they're getting, the insurance company is getting premium and subsidies, and it's just bottom line dollars going into it. So, but it's coming to an end, and it's a good thing.
I think
it's a good
so
thing
too.
for the country. It's an even better thing for the insureds. Hopefully, once this gets settled, when this gets figured out, what we're hoping is rates are going to come down.
Yeah.
Okay. Hopefully, the subsidies are still going to be there, and the insureds can get back where this is truly affordable for middle America.
I'm hoping we see an adjustment. It's just going to take some time. They're just now cracking on this, and I think you and I both like, hey, what's the plan? I mean, they just threw out that HSA that we spoke to a minute ago. Like, no, that's not going to probably work. Let's have some substance. They got some smart people over there in DC. I mean, you and I think you've been there too, where we visit with our congressmen. We meet these interns that are 18 and 20 years old. It seems like that are running the show behind the scenes. But I'm optimistic that it will come around.
It will. And here's the deal. And here's what happened. Guys, there was one thing that it really bothered me, Justin, is on social media, you had these posts that were made by these rogue agents. Come get your free $500 Visa gift card.
Man, they were flooding my feed. Everybody's.
And we'll throw in a 3 to 4 day vacation. Really? And then the problem is, Justin, is that people are so desperate. Yeah. Insurance companies are not in the business of giving money away.
No, they're
not.
In
the business of making money. So people are naive sometimes. Sometimes it's their fault, but it's also these rogue agents instigating that, preying on that desperation from these insureds. So one of the things I'd advise the insurers that are listening to this show, number one, an insurance company is not giving away money. They're not going to give you a 3 to 4 day trip. They're not going to give you a free Visa gift card.
Much less a gift card.
Okay. All that was just a ploy to get some data from you so that they could steal you or create a fake application.
Correct.
And you may have a family of 4, but on your application, you got a family of 10.
Yeah.
You had an extra 6 kids on your application that you weren't aware of. And that agent was getting a commission on that. The insurance carrier was getting premium on that. Well, all that is coming to an end. And it's a good thing that it is coming to an end.
No question.
And we do have some guidelines, and that's part of my teaching strategies where I tell agents, look, we have to follow the guidelines. We have to do these compliance procedures, but they're for the good of the insured. The insured has to make sure that the data that we agents are putting in is accurate.
That's correct.
And it is confirmed. Okay. So that's part of my teaching. Make sure you're just doing it right. Short-term gain is really just a short-term gain.
You do it right the first time, and you're going to be in good shape.
You're in good shape, 100%. And I already told you this, it's not hard to do it right.
Yeah.
It's not like you really have to go the extra mile. It's just a few little extra things you have to do. That's all you have to do this right.
So that was an ugly article there. The other one, or the next one, article number 2, this was from Stat News, and this was just a few days ago as well, June 1st of 26. This is big news. You and I kind of talked about this briefly before we kicked off the show. Medicare to cover $50 a month weight loss drugs, GLP-1 bridge program. This is big because a lot of, and the jury's still out on this because I want to see if they're going to do it just because, or if you'll have to absolutely have a specific diagnosis to cover this. But the proposed Medicare bridge program would cap GLP-1s, those are those Mounjaros and Ozempics and all that stuff out there, Wegovy, at a $50 a month for each beneficiary. Drugs like semaglutides cost around $1,000 plus. Okay, we saw that people having to pay that, and they were paying that premium. The program is designed as a transition while CMS finalizes broader Medicare drug coverage policy. Cardiovascular and weight loss benefits will be documented, could reduce downstream Medicare costs, significant budget implications. The estimates of the cost are still in flux, but I see people that are utilizing these medications with or without insurance. You had Trump RX that was trying to help out with some of those costs as well. This is a big deal for seniors on fixed incomes that are depending on these medications. How do you see that affecting the client?
So for the client, if and when this does happen, this is what these insureds are going to have to do. And it's all going to lead again to why these insureds need guys like us, why they need agents. Every Medicare company out there has a formulary, again, that is the list of medications. So you can assume that your GLP medication is automatically going to be covered. They'll cover one of them, but they may not cover the other one. So an insured, when this kicks off, the insured needs to make sure that medication is in that formulary of that plan that they're insured with. This is where agents are going to be able to help the insureds out to make sure that they're on the right plan that covers their doctors, but also has that specific GLP. Otherwise, just because there's we already are dealing with the insulins. Yeah. We have a $35 copay for insulins. Well, one carrier will cover this insulin, but it won't cover the other one. Another carrier will cover that one, but not this one. So you have to be, you're going to have to do your homework. Insurance, when this kicks in and you're on a GLP, you have to do your homework and make sure that specific.
And we're going to get more details on this because it's kind of up in the air, but it's a great headline to discuss in the show. And I think it's going to help some people. But you're absolutely right. You're going to want to deal with somebody that has a plan or the ability to work with these carriers and get you through it because there's going to be a process on this as well. So out of the good, the bad, and the ugly, now I've got a bad article. Mm-hmm. Article number 3, the Medicare surcharge most home sellers don't find out about until it's too late. This was an article from 24/7 Wall Street on June 2nd, okay? And this was interesting because it basically taps in to the IRMA. And a lot of people don't. We're going to chat. We've been talking a lot of ACA. Now we're going to switch over to Medicare real quick. IRMA is cannot be your friend most of the time. Okay?
Nobody likes IRMA.
Nobody likes IRMA. And IRMA stands for Income Related Monthly Adjustment Amount. And it can spike your Medicare Part B and Part D premiums. A lot of times this is missed. I remember when I was a first agent, learning this out, and I was figuring out, oh man, this is something that can affect our insureds, our clients, and you don't really realize it until you start working with people. And years ago, it was like we were realizing how many people this is starting to affect. One-time capital gain can push a retiree into a higher IRMA bracket for 2 years. Okay, and don't get me wrong, you can appeal that. Maybe it's a one and done, and they have the discretion of being able to do that. I've had some clients be successful, not everybody, but some. The effects whose income jumps above $106,000 individually, or over $212,000 married, even temporarily, is going to trigger that. So, an appeal process I just mentioned exists. For a life-changing event form, a lot of times we'll have higher income earners and they're retiring and they're not making that type of money anymore. Hey, it's a pretty cut and dry review. But if you sell your business for, millions of dollars and you retire out, that can be a little bit harder fight. And maybe you're just not going to have to pay it as much as you probably could. So with that said, the kind of things our clients need to hear before they sell their home, as us as agents, let us know. Just like ACA, Medicare as well, your income, your adjusted gross income, that is, can affect what you pay premium-wise. I'm sure you see this all the time as well.
All the time. And you missed one here.
What'd I get?
So you missed one of the other, no, when I say you missed something, not a topic, but a way somebody can get into IRMA.
Oh,
so selling of a home.
Yeah.
You sell a home and it's completely paid for, and if you exceed a certain amount, it becomes taxable.
Correct.
Okay. You sell a business. Okay, taxable. What about a distribution from a tax advantage retirement account?
Absolutely right.
You go take out 50, 60,000 because you need it for something. Well, that's considered ordinary income.
They're going to knock on that.
Yes.
And say, hey, listen,
it's going to bump you up. So yes, it's one of those things that this is not our issue, but we need to educate our clients that this could happen and that they're going to have to work with Social Security on possibly getting that down, or they're just going to have to pay it for 2 years and then it'll drop back down.
Correct.
But again, this has nothing to do with the services that we offer.
And if you think about it, hey, you're in a position where you did get a windfall of money, and this is but this is one gotcha that people are like, man, I'm already paying a fortune for this already. And their Part B premiums are increasing, and, they didn't necessarily get a good adjustment on their Social Security. I understand why they complain about it. So, and some, are just getting popped on $800 a month in Social Security deductions because of that income. And it's tough to watch.
It is.
Let's keep on going on a few articles here. Again, just to let everybody know, the Mad Insurance Show, making a difference in insurance. I'm your host, Justin Holland. I've got fellow Sideline agency owner and agent trainer Luis Moreno joining us. And we're basically now talking about a handful of articles, some news that we want to make sure you as the consumer out there that are probably listening to us on the radio here on KTSA 550 or 107.1. And or you're watching us on and after we've recorded the show and put it on YouTube, we're discussing these articles. The next article I'm going to go over is article number 4 that we pulled up, and it's an ugly article. So I've labeled these. Brett Blackman, Health Splash convicted of Medicare fraud. This was pretty nasty, man. This was Brett Blackman, founder of Health Splash, convicted of multiple Medicare fraud counts. Okay. The scheme involved billing Medicare for services never rendered or not medically necessary. He marketed himself as a health tech company, fraud hidden behind legitimate-looking operations. We're seeing this in California. We're seeing this in South Texas. I saw some big stuff in the Rio Grande Valley on this. And the Department of Justice is cracking down on this with these Medicare fraud allegations or convictions. Agents and brokers like ourselves need to be aware of this because it gives us some peace of mind that, the DOJ is finally cracking down on this because we have to take on these higher premiums and these higher costs that we've got to educate our clients on. If they can start curbing that fraud, you mentioned a minute ago, maybe these rates, maybe this cost of insurance will go down lower or benefits will get better. But it's hard to do that when you've got, individuals like this damaging the public trust. And I mean, and we're talking, this isn't hundreds of thousands of dollars. We're talking multi-millions, tens, hundreds of millions of dollars. What's your take on that?
Here's my take on it. And it's just not, it's doctors too. It's,
You're right.
it's medical providers, billing for a scooter that they should have never gotten. These durable medical equipment companies. It is not, it's a bad thing that it's very prevalent out there. What can we agents do to help insureds out with this? Mainly education. We need to tell our insureds, hey, when you get a bill, when you get that explanation of everything that you were charged, review it.
Yeah.
Just take a look at it. If you see something in there that wasn't done and they're billing you for it, bring it up to the agent's attention because we have a way of reporting that to the carrier.
And let us know before you pay it.
Yes. Yes. Let the carrier know.
Yeah.
Maybe you don't want to let us know. Call your insurance company and let them know, look, this is what I went to go do, and they billed me for these 5 things. They never did that to me. Then they'll jump on it and they'll take care of it. So it's really an education process. What these people that are doing these billing issues so that they can get more money is they're hoping that insureds are never going to look at that bill. It's going to go in a trash can. They're going to open it up and they don't care. And a lot of insureds don't care because the insurance companies will just pay it out. But everything comes around. Okay. Everything, if the insurance companies are paying fraudulent claims, well, premiums are going to go up.
Correct.
Okay. I mean, we're all going to pay for it.
Or they could come back and you could be on the hook for that claim. I mean, sometimes it takes months, if not years, for them to come back. I've seen it, where you see these reconciled EOBs and they're like, hey, you had this amount and now it goes to this amount. Now, that might not have been a fraud situation, but it could be, off of that as well. Okay, cool. I wanted to make sure we discussed that because I don't see many people talking about that, or the headline hits for a minute and nobody brings it up again after that. Article number 5, and I labeled this as the bad. I think it's kind of bad and good, maybe not necessarily ugly. This was an NBC News article from a few days ago. The Trump administration released details on who would be exempt for Medicaid work requirements under the new rules. So ultimately, exemptions include children, pregnant women, people with certain disabilities, and caretakers and dependents. I'd agree with that.
I 100%.
I think that's a legitimate reason or exclusion. Millions of other low-income adults would be required to provide work documents, job search, volunteer hours. I think this is a good thing. I mean, critics are going to warn the implementation and cause of eligible people to lose coverage during the paperwork barriers. You're right. I could see that being an issue there. But, states like Texas here, they face major implementation decisions because significant agent opportunity is helping clients navigate to alternatives. Well, something I want to throw in here, and then, Luis, I want to get your take. Before I got into this insurance business, there was things called risk pools, okay? Not real familiar with it because they were basically getting phased out with the Affordable Care Act.
Correct.
And I have no problem, even if I were to get taxed, if some of that money or all of that tax portion, whatever it is going into a risk pool to help protect individuals that just didn't get a fair shake, man, that could be a solution there if you think about it. ACA, no underwriting decisions. Where I'm going with this is because Medicaid is not expanded to adults. You either got to be elderly, a pregnant woman, or a children within a low-income situation. And Luis, I'll have people that, they're in a really bad spot, and they don't have access to any coverage or they don't qualify for a tax credit through the marketplace. I just think there needs to be something in place for those individuals. What's your take on that?
My take is a little colder.
Okay.
I think there's a smaller portion that is what you're saying.
Yeah.
They don't have the ability to, but I think a larger portion is exploiting the system.
I would agree with that.
They're not working. They don't want to work. It's not that they can't. They don't want to. They love the free benefits. And my colder take on it is like, get out there and work. I'm working.
Yeah, I agree.
I get up at 5 o'clock every morning. Okay. And sometimes I don't come home till 7, 8 o'clock. I'm doing that. Well, what a luxury that you have to get these benefits and you get to stay at home and do nothing.
Yeah.
I'm cold. I mean, last night I didn't get home till 9 o'clock.
I was still plowing through the evening as well.
And I tell insurance agents, I have a luxury that I've earned 25 years in the business, which I don't take advantage of.
Yeah.
I would love to be home at 5. I've gone home at 5 sometimes. I'm like, this is what it feels like. 5. I'm like, wow, I get to see the 6 o'clock news. I'm not used to that. Okay. I tell agents in this business, the first couple of years in, you're doing this 7 days a week.
Oh, yeah.
You're working long hours, but you're working for that luxury down the road where you can afford to come home at 5. So my take is a little colder with it. I do think there needs to be a process to help those people that truly need Medicaid. But the larger portion, I think they just exploit the system in however way they get it just to get the benefits. And I do like the fact that they have to go work.
I like that too.
I love that. Go work. Okay, we're needed out here with the new immigration situation and people being sent away. There's jobs out there you can do. You may not want to, but you can.
Meet these exemptions, great. If not, hey, maybe later.
Exactly. But you know what? Get out there. Get out there into the workforce, or at least try to get out to the workforce.
I'll never forget this. I can't remember if I've talked about this on one of the prior episodes, Luis. My very first potential ACA client came in. It was a young man, came in with his mom. Okay, I think he was maybe 18, 20-something years old, and he wanted his free health insurance. He was told he's got access to free health insurance, Affordable Care Act, Obamacare, health insurance marketplace, whatever you want to call it. He's sitting in my office, and I'm like, "Hey, buddy, it doesn't work. It's not just free. You gotta. What's your income? Well, I don't work. I just need the insurance. I'm like, unfortunately, sir, you got to meet an income threshold because it's a tax credit. And he was furious. Okay, and I'm sitting here looking at him like, and I wasn't trying to judge. I don't know this guy's situation, but he looked like he had the means of work. He said he had done some part-time work, but he didn't qualify. But that was my very first visit. I was like, man, I'm in for a treat in this industry from the very get-go, and I felt so sorry for this mom. It's like, I wish you would, take that initiative. But you and I both see some beauties out there, some scenarios out there. We're like, man, it's, I'm glad we're doing this.
Yes,
on the Medicaid.
I wanted to say something, and I was at the grocery store, and I saw somebody with food stamps, and I cannot believe I'm with a regular type of meat, and this guy's getting the A1, Wagyu with his food card.
Oh, wow.
And I'm like, oh, yeah.
And that just shows, how much, fraud, waste, and abuse that could be out there, or indulgence in that situation for that as well. Let's talk about a good article.
Let's do that.
Article number 6, healthcare.gov special enrollment documents and deadlines. I don't know if this is a good article, but it's good to bring up the fact that CMS updated documentations and deadline guidance for special enrollments periods. Agents and clients now have clearer timelines, which is actually good. We're being consistent with that on docs after a qualifying life event. Sometimes the marketplace wants these documents. Sometimes you just do your enrollment and they don't even request it in some scenarios. But key events that people need to know are loss of coverage, marriage, birth and adoption, income changes, or even moving, zip code. I helped out a client last week alone. They were moving, and they were able to get their coverage intact off of that. So with this discussion, the resource that every ACA agent should bookmark, specifically for what you're doing with the training, I think SEPs are very important for everybody to know that they have access to or might have access to.
100%. So an SEP is a special election. It is a way to get into or get coverage outside of the regular open enrollment period. With this administration, they have tightened that up. In the past, it was a little loose, but now it is very, very tight. You have to meet a special election outside of the enrollment period. Otherwise, you cannot get a policy just when you want it. Here's an analogy that I use, Justin. Think of home insurance or maybe auto insurance. This can relate to anybody. You just can't have a wreck in your car and go buy insurance and expect them to pay for your wreck. Or your house is on fire. Well, now I want to get insurance. It doesn't work like that, guys. You have to have the insurance prior to the event. So for you guys, for your insureds out there, it is vital that you get enrolled during the right time. This coming year, just to let you know, the open enrollment period is from November the 1st to December the 15th. The entire country has to enroll, either get into a plan or make a change to their plan within those 45 days. Outside of that period, you have to meet a special election. Now, I've seen a little bit of the reverse of what you just said. When somebody relocates, when somebody gets married, when somebody loses their job, I've seen more documentation requests from CMS, from healthcare.gov, asking, so you relocated, prove that you lost insurance. You changed your jobs and you lost your insurance, prove it. So the new administration has set these requirements to prove that you actually lost insurance, allowing you to take advantage of a special election. But it's hit or miss. Sometimes they don't ask for it. Yep. Sometimes they do. It's really a flip of a coin. But what I would, two views that I would share here. Number one, insureds, consumers, make sure you get in when you're supposed to. Connect with an agent. Connect with Justin. Right between November the 1st and December 15th, that is the time that you need to enroll for the following year. Agents that are out there, you need to be very aware of the rules.
Oh, yeah.
You need to know when open enrollment is, and you need to scream at the top of your lungs to everybody that you know. And when I say scream, not literally scream, but you need to scream on every social media platform that you are on. You need to share with everybody that this is the time to get in. Because outside of this open enrollment, it's difficult to get somebody in.
No question.
So part of my training of insurance agents is I make them very aware when open enrollment is, how we share, how we scream. There's a way to scream on social media that it is now open enrollment. Hey, connect with me. I help agents do that.
We're wrapping up the show here in just a minute. We've knocked out all of our articles that I wanted to bring up. But I wanted to bring up one thing that we'll wrap up with. And listen, we want to help individuals have affordable insurance out there, specifically premiums. But I think what catches people off guard is, hey, they've got an affordable premium, but that deductible and that out-of-pocket maximum exposure, that drug deductible that can sneak up on you on some of these bronze and expanded bronze plans. Just because of the agent training that y'all are doing, I'm assuming that's a big factor so we can educate and make sure the consumer, the insured knows, hey, this is some exposure that you've got deductible, out-of-pocket wise, even in the drug deductible. What's your input on that, Luis?
My input on that one is a $0 premium or a very low premium doesn't mean it's the best plan.
Yep.
So you are right. When you purchase one of these plans, there is a deductible that needs to be met. Recently, they've added or combined a deductible to prescriptions. So you may not even be able to get your prescriptions without having to meet that deductible first. An insured needs to be made aware of that. Also, there's copays for doctors and for specialists. Sometimes if you get into a plan, you may have to meet the deductible before those copays apply. So again, going down to a very low premium plan doesn't really mean it's the best plan. It could end up costing you more.
Oh, yeah.
So that's where a good agent needs to explain. Yes, this plan is lower in premium, but when you go get your medications, you're going to have to pay the full price.
One quick example on that. I mean, people look at hone in on those bronze plans. For a little bit more, they probably could have gotten a gold if they weren't in that silver bracket, that magic number for silver plans. But a lot of times, we were able to get that client into a gold plan for a reasonable premium versus that bronze. Did you see that out there as well?
100%.
Okay.
And that's where a good agent, you present the bronze may be 0, but the gold may be 100. It's $100. Yes, but if we put you into that $0 bronze, then with these medications or these doctors you're going to go visit, that $100 savings is going to cost you more. You're going to spend $300. So in actuality, it's costing you an additional $200. It's worth it for you to get the $100 plan. Okay, so that's where a good agent, an agent with training, can share with you. So it's a matter of just connecting out there with good people.
Luis, this has been a great show. We've been hammering out articles. We got some more insight on you. Give us your contact information online, and we're going to wrap up the show. But can you remind us how we can get in touch with you?
Most definitely. Now everybody's on YouTube. Okay, that is so you can find me on YouTube. Okay, if you go to YouTube and you do a search, you can find me with my name, Luis Moreno. Or you can find me with my agency, which is Insurance Agent Training.
Okay.
And ultimately, my goal is to help agents get into the business and train them the right way so that they can have a good, profitable, long-term business. Or if you're with somebody at an organization right now that doesn't train you and support you, but you're thinking, man, I got to go somewhere where I can get some help so I can grow my business. Guys, connect with me on YouTube.
Okay.
On every YouTube video that I put out, and I just started this because I just learned about QR codes.
Yeah.
So easy to make.
Oh,
There's
yeah.
a QR code on my videos now. You can take a picture of it and fill out a form and we'll connect with you.
Very cool.
But my email, my phone number is on every video in the description. Best way to get a hold of me is on YouTube.
And we'll have your description details on our YouTube post when we put this out there online as well. I cannot thank you enough, Luis, for joining us, man. You've been a great friend and sideline in the industry. Sometimes a venting partner as well. I think we might need to do this again as we get closer into the end of the year, on the heels of our open enrollment, our busiest time, just to provide some of that awareness. But just to remind everybody, you've been listening to the Mad Insurance Show, Making a Difference in Insurance. I've had special guest Luis Moreno with Insurance Agent Training, a very successful local agent here that's servicing all of Texas as well. And we've been talking about some articles. If you've got questions regarding your health insurance, Medicare, individual health coverage, employee benefits, give us a call, 210-880-5316, or visit us online at txstateinsurance.com, or you can visit palmettolifegroup.com for all your life insurance needs, long-term care, retirement planning, Social Security analysis, your auto, home as well. That phone number is 877-357-5316. Luis, thank you again. Hopefully you can join us again in the future, and we'll have some better news. But we'll also have those good, bad, and ugly articles as well.
I cannot wait. Just ask and I'll be here.
Very cool. Thank you again, Luis. Everybody, thanks again for listening. Y'all have a great weekend, everybody. Take care.